name is Wanda Starks. I'm with Hotchkiss Insurance Agency. And today we're going to talk about healthcare reform and how it can affect your business. I hope you enjoy the presentation. Some of the things that we're going to talk about today may change. We have the law, and it is the law of the land. But the rule makers from the Health and Human Services, Department of Labor, and the IRS, they're rolling out the regulations and how this is going to work. What we do know is it will happen quickly, and I want to help you to be ready. We're going to look at timelines for 2013 and 2014. Is your business subject to healthcare reform? We're going to talk about commonly controlled companies. And we're also going to help you determine just how many employees do I really have? Fines for your business. Are you going to pay? Then we're going to do a little planning for 2014. Key timeline issues for 2013. FSA, or Flexible Spending Account contributions for medical expenses, have been limited to $2,500 per year. We've seen an increase on our Medicare payroll tax by 0.9% for our earned income. There's an additional 3.8% Medicare tax on unearned income. That is for certain high-income individuals over $250,000 a year, married filing jointly, or $200,000 a year for single filers. An additional excise tax is being levied of 2.3% on medical devices. These medical devices are materials that doctors and hospitals use. We're certain to see price increases. The last bullet point talks about employers notifying employees about the existence of the exchange marketplace. We've yet to see the details of the contents of these notices. We're expecting to see those in fourth quarter 2013. 2014, healthcare reform is here. State-based exchanges. What is an exchange? Think of it like a Travelocity. Individuals, small businesses can go to an internet marketplace and purchase insurance. October 2013, enrollment is open for January 1st. Individual mandate and premium tax credits. Individuals between 100% and 400% of the federal poverty level can receive subsidy assistance to help them to purchase insurance on the exchange. Small employers may receive up to 50% tax credit if they purchase through the exchange. The employer mandate. This is the big one. Employers over 50 employees must provide health insurance or pay the fine. 50, that's the number. If you're under 50, no worries on this bullet point. Medicaid expansion. Many states across the nation will add to their Medicaid rolls in an effort to provide health insurance to the uninsured. Texas has opted not to expand Medicaid. The other insurance market reforms that we're going to talk about is guarantee issue. In 2014, no pre-existing condition can be held against you. No annual or lifetime limits. Guarantee issue. The ratings are all going to change. This is going to drive the underwriters crazy because no longer can they hold your sickness against you. It's going to be coverage tier, that's employee only, employee spouse, your zip code, if you use tobacco, or your age. By the way, if you do use tobacco, that's a 50% increase. Health insurers fees. Have you heard about the $63 per head? That's where this little charge is hiding. This charge was meant to cushion the cost of all you folks with pre-existing conditions jumping on the exchanges. We look for prices to increase. Employer reporting to the IRS. We don't have the specifics of the reporting, but what we do know is the IRS will be looking for your employee accounts, who's part-time, who's full-time, and are you covering all of your eligible employees. We'll also have federal-based standards for qualified coverage. Those include essential health benefits in the small markets. Minimum essential benefits must pay at least 60% of the total cost of benefits. We're not sure exactly what these benefits look like, except for they will include outpatient patient services, emergency services, hospitalization, maternity and newborn care, mental health, prescription drugs, rehabilitative services, and lab. Oh, also, preventative and wellness services and pediatric services, including oral and vision care. No limits on these essential health benefits. Where does your business fit? Generally speaking, only large employers over 50 full-time equivalent workers. That's full-time equivalent, not full-time. We have to add these up, and this is going to include the full-time workers that are 30 hours per week. You may think full-time is 35 or 36 hours, but the federal government is defining full-time as 30 hours per week. Then we're going to prorate the part-time workers. This healthcare reform law applies to for-profits, to nonprofit groups, and governmental entities. Let's look at an example. This company has 42 full-time employees working 30 or more hours per week, 50 part-time employees that are working an average of 60 hours per month. We take 50 part-time employees times the 60 hours that they work per month. That's 3,000 hours divided by 120, and that gives us the magic number of 25. We also have 22 seasonal employees working under 120 days per year. For this example, we're going to pull out the seasonal employees and just look at the full-time and the part-time. So with the full-time employees, we have 42, 25 full-time equivalents. This business has 67 total full-time equivalents. So this business, even though you only have 42 full-time employees, you have 67 full-time equivalents. Healthcare reform applies to you. What about common controlled companies? Common controlled companies are companies that have multi-locations, different tax ID numbers, but common ownership. With healthcare reform, those common ownership companies are considered as one when you determine whether the employer mandate applies. Look at the common percentage of ownership among the various businesses, and if it's over 50%, you are one company for healthcare reform. Each entity will be responsible for their share of the penalty if one is applied. The penalty is focused on the group that's being non-compliant instead of the entire group of companies. There are two ways that a business pays fines under the healthcare reform law. The first way is if you're a large employer over 50 employees and do not offer coverage. That penalty would be $2,000 for every full-time employee every year. You do receive a credit for the first 30 employees. Let's look at an example. This large employer has 75 full-time equivalent employees and does not offer coverage. Remember, we receive a credit of 30 employees, and that brings us down to 45 employees that we must pay a penalty. The no coverage penalty for these 45 employees is $90,000 for the first year. The most important thing for you to remember about this penalty is it is an excise tax, which means you will pay this with after-tax dollars. Get out the checkbook. The second way that an employer can incur a penalty is if that large employer offers unaffordable coverage. Affordable coverage is defined as an employee paying less than 9.5% of their W-2 Box 1 income for employee-only coverage. The penalty for offering unaffordable coverage is $3,000 per affected employee. This penalty is capped at the employer's maximum penalty. In this example, this large employer is offering unaffordable coverage. We have 75 full-time equivalents and 45 full-time employees, but only 3 of those employees are spending more than 9.5% of their income for employee-only coverage. The penalty in this case is $9,000 excise tax. How are these fines triggered? If an employee goes to the exchange, there is a penalty. If the employees do not go to the exchange, the penalty can be avoided. Now's the time to plan for 2014. Large employers should take a hard look at your employee populations. Determinations for 2014 are being made today in 2013. You must determine who are my full-time employees, part-time and seasonal. Don't forget the variable employees, those folks that work different hours every week. There are formulas available to help you. Employers must be consistent in your tracking methods. If you have questions, contact me today for calculations and compliance help with healthcare reform.